scanning the room, I have my medications right here, and then my math calculations. First, I'm going to start by doing the standard administration for medication. I would start by washing my hands, and then checking the doctor's orders, and then I would note of any allergies. I would check I have the right patient, the right medications, the right dose, the right route, the right time, and then I would take out my first medication, check the name, the dose, expiration date, and then I would do any dosage calculations if needed, and then I would do a check again of my medications with the name and the dose. I would identify my patient, asking their name and date of birth, and then checking with their wristband, and then I would check the name, dose, and expiration date for a third time. I would administrate the meds as ordered, and I would use gloves if needed, and then I would leave the patient sitting comfortably. Before I administer the medications, I would explain why the patient was getting the medications, and then after administering them, I would throw away equipment, my gloves, throw away my gloves, wash my hands, document and initial, and then I would come back and check in with the patient in about a half hour. So my first medication is 5,000 units of heparin subcutaneous. So I have my 1 milliliter syringe here, and I would use a 5/8 inch needle with a 25 gauge, and I would administer this in the abdomen. There's a 1 inch margin around the umbilicus, and then I would administer in the abdomen, pinching the skin and administering in the abdomen. For the second medication, I have vitamin B12, and I have a dose of 1 milliliter. And then I would use, this is intramuscular, so I would use a 1 inch length needle with a 22 gauge, and this would be administered in the deltoid. So I'd locate the acromion process on the patient about 2 or 3 fingers down. I would find the deltoid muscle, and that's where I would administer it. And the next is digoxin 0.25 milligrams IV push. I would put on gloves, and then I would go to the site, make do if this was a vein, and first thing I would do is get an alcohol pad and scrub the hub. Scrub the hub, and then I would take first saline to make sure that it worked, saline flush. Okay, then I would take my medication, and for this it is 1 milliliters, and I would push as per protocol of what the medication would be pushed at what rate. Then I would take another saline flush at the same rate that I did my medication at. All right. IV push is all set. And then the next medication is an inhaler. So it asks the patient assess their ability on how well they can use the inhaler. Please use this and show me how you do it. With 1 minute in between each puff. Okay, 1 minute. All right. Thank you. Would you like any water?
Okay.
Okay. The patient displayed abilities to use the inhaler correctly. No need to further educate or help. 2 puffs every 6 hours. The next medication is cough medication. And I'm going to pour the liquid at eye level. And and this is 2 milliliters. And here, and it's as needed, and the patient told me she wanted to take the medication for her cough. Thank you. Next, we have the nitroglycerin transdermal patch, and I dated and initialed the new patch. First thing I would do is take a alcohol wipe and clean the area, and then I would have placed the new patch. All right, and then the last medication is eye drops. So I have the patient laying down, and when I first get over to her eye, I'm going to assess the eye area, and then I'm going to administer 2 drops into her right eye. The eyes look okay, and then the patient's right eye. All right, great. All set.